Hey guys, so I wanted to make a quick video about how I organize and think about cardiology because I kind of find creating a scaffolding to organize this material is probably the hardest part. So I don't really start with the physiology, although that is a key part. I really start with trying to figure out a way to sort of structure all the cardiovascular diseases. And here's how I do it. So at the end of the day, all the cardiovascular diseases you learn, whether it's an MI associated with atherosclerosis, or valve disease, aortic stenosis, aortic regurg, or arrhythmias, or whatever. There's more diseases than I listed here. All of them, in their terminal presentation, lead to heart failure. So if we start with heart failure and really get a good understanding of heart failure, a good definition, a good understanding of the ways it can present, and its signs and symptoms, well, then we can kind of start with heart failure and go back to each of our other diseases and ask similar questions about those. So we can ask ourselves, well, how do the acute coronary symptoms present? What are tools that I can use to measure, say, an MI? What is the treatment? What is the management? And then I can go and do the same thing for valve disease. And every time I'm asking, well, at the end of the day, how do these diseases lead to heart failure? Now, another part of your guys' lecture objectives is really kind of getting at how you measure all of these diseases, both clinically and in the lab. So kind of the first place to start, because a lot of your patients are going to be coming in without any prior history of heart disease, potentially, are going to be your physical exam findings. So really, most of the time it comes down to that. And I like to think of the physical exam findings for cardiology and break them down into things you see, things you hear, oftentimes with your stethoscope, and maneuvers that you can do. And I just list some of the findings here. So you can see jugular venous distension. That's often associated with heart failure because heart failure is associated with backup most of the time. Things you hear, well, you can hear crackles or ralls in the lung. Crackles and ralls are the same thing. Ralls just means rattle in French. People didn't want to call it rattle because it was reminiscent of death rattle, so they called it crackles. And that's just a sign of pulmonary edema, which is, again, associated with heart failure. And then we have all these different heart sounds. S1 and S2, which I forgot to list S1. S1 and S2 are normal heart sounds. You hear them all the time. They're physiologic. While S3 and S4 are pathologic and associated with kind of various manifestations of heart failure. And then we also have our murmurs, which are associated with our valve diseases. And then in terms of things you do, this isn't a complete list, but one thing you can do if you're having evidence of right-sided heart failure, you're trying to really bring out jugular venous distension, is to press on the liver. And what that'll do is oftentimes, because the hepatic veins are connected up to the IVC, is that'll lead to jugular venous distension and evidence of backup. So that's kind of our physical exam. In terms of echo findings, so this is where you put an ultrasound probe either over the heart or within the esophagus. You can get a lot more kind of quantitative estimates because we're interested in kind of estimates of pump function. We're interested in cardiac output. We're interested in ejection fraction. And so this can really give us a good sense of how the heart is behaving and what is maybe wrong with the heart. And these variables and visualization of the heart can help us diagnose all these different pathologies in addition to our physical exam findings. Now, we have our EKG. And EKG can tell us a lot about manifestations of ischemia, manifestations of pericarditis, arrhythmias, things along those lines. Basically, the electrical and electromechanical coupling of the heart. And finally, PV loops. Now, PV loops aren't really used clinically. They're used more in like basic science under very controlled settings. But they're a really, really nice conceptual tool. I'm not going to get into like a ton of detail here, but PV loops allow you to get a sense of how pathology, whether it's aortic stenosis or aortic regurg or whatever, causes perturbations in stroke volume and ejection fraction and cardiac output, etc. So what I recommend doing is when you're learning a given pathology, so say you're learning aortic stenosis, what you want to understand is kind of how it develops and its mechanism. And you want to understand how it perturbs normal physiology and how you can measure it. So how you measure it, how it perturbs normal physiology. I know my hand's kind of blocking everything here. And also how it leads to heart failure. And don't just do this for aortic stenosis. What I'm suggesting you do is do this for every single pathology that you're learning about, whether it's aortic stenosis or myocarditis, and think about how the tools that you use, like how would your PV loop change in aortic stenosis or aortic regurg? This is how you can really start tying everything together. Okay, I think that kind of ends the video. So I will talk to you guys on Friday, I think.